So let's go to the map, Pierre, the next slide. Thank you. So this is a map of our service area, and I will go through what I've already said, but we also, we refer to the hospitals that are represented. We admit patients to UCSD, to Children's, many of you know Ken Luan, Sharp hospitals, and because of our geographic presence, we pretty much admit patients and refer patients to the specialty groups of all the health systems in San Diego County. Next slide, Pierre.
Yes.
I'm really going to talk about the process. So one of the problems we have is as a federally qualified health center, there's certain rules for us that are different than they are for the private practice community and the hospital community. And billable visits have to be face-to-face encounters with a patient and a billable provider. So in normal circumstances, we can't see patients from a telehealth or telemedicine perspective or program. So one of the things that thankfully happened last year as a result of another disaster, the wildfires up in Northern California, legislation was passed that when a public health emergency was declared, it allowed federally qualified health centers to continue to provide services via the telehealth and telemedicine option. And unfortunately, that only lasts until the declaration of the public health emergency ends. So we're looking at trying to get legislation that will change that going forward, because we believe, like everyone else has said, that some version of telehealth is here to stay. And hopefully we'll be able to work with our state and federal government to allow that to happen for federally qualified health centers. Next slide, Pierre. So how do we, normally to do the transition we did in about 10 days, we would probably spend a year or two planning a transition to telehealth. And we didn't have that ability this time. I think it was March 15th of 2020, we met with our executive team and we laid out a plan. We shut down several of our clinics. We didn't have enough staff to support. We didn't have the social distancing capabilities to support our normal patient flows. We typically see over 2,000 visits a day. And when the public health emergency was declared, that went to probably 200. And those were really just emergency visits. Dental services is an example. We do about 400, 500 dental visits a day. Dental was one of the highest risk types of visits that we do, and because of the aerosol, I can't say the word, the virus being aerosolized. So we had to shut down our dental operations for about 90 days while we got in some equipment to help make that a little more of a safe environment for our dentists to practice. I think we go to the next slide. So our first step was just to convert to plain telephone visits. We were researching the options for telehealth visits, but I think initially 90% of our visits were done over the telephone. And we kept our patients on the schedule. We asked our physicians to look at who was scheduled to see who still really needed to come in. And we created that option so the people that needed to be seen in a face-to-face visit were able to do so just under new rules. Waiting rooms really are non-existent today. I mean, we can't have people congregating in the waiting rooms. We had to come up with different workflows in order to make that happen. But immediately 90% of our visits went to telephone appointments. That created some problems. I mean, we also have staff that were at-risk staff. We have older physicians. We have people. Our staff aren't immune to the chronic conditions that the patients have. So we had many of our staff that weren't able to see patients. So we redeployed people to the home. We had all the difficulties people have talked about in getting equipment. Web cameras were in high demand, et cetera. So our first step was, how are we going to do this? We used some wireless headsets, soft phones, and we started training all of our providers on how to use that and support staff on how to use that equipment. Next slide, Pierre. So this is kind of the history of going back to March of the number of in-person visits we have. The purple line is the telehealth, and if you went back to February, that would be 0. We had absolutely no telehealth visits prior to March 15th, and you can see the rapid increase in April of 24,000 of our visits. And at that point, 86% of our visits were being done via telehealth. As you can see, our visits have kind of declined a little bit or stabilized a little bit, and our in-person visits have been increasing, but it's still difficult to get the patients to want to come in and see their physician. And I think a couple, Dr. Friedman mentioned, the fear still of patients wanting to come, feeling comfortable coming in. And as much as we've made the environment safe, there's still this perception that it's not a safe environment. We're getting a lot of feedback. We're not getting the routine public health maintenance type of visits that we need: breast screening, mammography screening, colorectal screening. The things that have to be done in person just aren't getting done. So we're trying to figure out a plan how to get those preventative measures taken care of. And over the last 9 months, 70% of our visits have been done via telehealth. Next slide. So we also developed what we call the San Ysidro Health line, which was immediate access for patients calling in to a provider. So we started publishing numbers. We did through the Well app, we did a text messaging campaign to let our patients know that if they needed access to a provider, they could get access, and they could call our number, and we would see them over the telehealth, or as necessary after screening, we would bring them in. Next slide. And this kind of shows our current status up to, I think, last week. And it shows, if you're not aware, this isn't a surprise to anybody in any of the presenters in San Diego, we're in the middle of a surge right now. Our number of visits being called on a daily basis, we're averaging over 250. These are billable encounters. We're actually averaging over 350 encounters a day to our health line for access to a physician. And like I said, right now is the highest it's been since the beginning of the pandemic. We can go on to the next slide. So what did we do for our virtual visits? We have 4 providers that are exclusively doing virtual visits. And then we have the rest of our 80 providers. A portion of their day is done to handle those patients that call in. So if they don't have a full schedule, they have a patient no-show, they're in the queue to pick up calls from the health line and have virtual visits with those people that call in. We chose a platform called DoxyMe to utilize, and that was really because it was easy for our patients and our providers to use. Don't know if it's a long-term solution or not, but it's worked for us for the last 9 months to get these telehealth visits. Next slide. We use an application called Well app, which is a patient communication application where we text our patients reminders if they have health maintenance issues that we need to bring them in for, appointment reminders. We also use it, we have the patient text when they arrive. The patients that are coming in, we send them a link and they can text the office when they arrive, and we can let them know when it's okay for them to come in. So we're using this Well app application to communicate with our patients, both when they need care or when they're accessing care. Next slide. And I think so there's challenges. One of our biggest challenges today is it's been hard to recruit and retain staff. We have many critical positions: our medical assistants, our call center reps, our patient access reps, our front desk workers, where we're probably at about 50% of our positions are vacant. Whether that's because they they have to stay home and homeschool their kids, or whether they just don't feel comfortable working today. We're having a difficult time keeping people to work. But other things, you know, this was new to everybody. We didn't know what the documentation requirements were going to be from the Medicare and Medicaid programs and how we were going to do that. You know, I mentioned before, we weren't the only ones looking for telehealth related equipment, for cameras, for laptops. I mean, there was quite a bit of wait time to get the equipment in we need. We did this in about a 10-day process. So we didn't have time to test and do all the things that we would normally do in implementing a new system. And it was unfamiliar for our patients, providers, and staff. So there's still a lot of challenges that we faced, and we've gotten through them. We're 9 months into this, and it's a much easier process today, but certainly we face challenges up front. And then finally, you know, going forward, the next slide, Pierre. As I mentioned before, we need a legislative fix in order for us to continue utilizing telehealth services. We can only do it now when there's a public health emergency declared. And patients aren't ready to start coming back. I don't know how soon that's going to happen. Hopefully sometime early 2021. But that's our biggest challenge, along with getting our workforce back and getting the people need to support the clinics the patients that we serve in the clinics. So just a quick, it's kind of more of a confirmation of what the UCSD and Children's is doing, very similar, I think, to their efforts with telemedicine and telehealth. You know, it's been a necessary component. We would have had to close our doors by now without it, but we've been able to sustain our operations, and looking forward to new challenges for 2021.